When it comes to health, education is always one of the most important things. And tonight, Dr. Joseph Assini and Greenwood Leflore Hospital doing what they can to educate the public. Dr. Assini, glad you're here this morning.
I'm very happy to be here, and I'm very excited not only for myself, for the doctors at the hospital, but for all the people in the Delta. What we have tonight, and please look it up on Greenwood Leflore Hospital on Facebook, you will see what we have prepared tonight. Between 6 and 7 o'clock, we have 11 or 12 different medical specialists, and they're there to answer in a fraternal fellowship way, not your typical doctor-patient way. There's no paperwork. We are going to meet in fellowship to answer questions about diabetes with all these specialists. So we have specialists from eye to dental to kidney to GYN to gastric to vascular to wound care to heart, cancer. We have every specialist. They were so kind to give their time, so we're going to meet between 6 and 7, and I'll kind of moderate this, and just bring your questions, or if you have no questions, just come and sit and learn. Right. Because we believe the hospital's mission in response to community surveys and the Board of Trustees and the administration, we want to put together a program where we can actually make a difference in the lives of people. And bringing all these specialists together in fellowship and providing education, we hope to give the tools to people to better manage their diabetes to avoid what? We've talked about for the last 2 years, and the station has been a partner in this. We want to end blindness. We want to end kidney failure that ends up in dialysis. We want to end loss of limb, okay? And we feel that while we may not be able to stop you from having diabetes, but through the education, we can stop the tragic endpoint of that.
And so many, you've addressed it before, so many people here in the Delta deal with this disease.
Oh, we are in the epicenter. 1 in 3 of hospital admissions have diabetes. And we're the epicenter, and we want to change it around so we could be the beacon of light to fix this. You know, we have 400 million people in the world have diabetes right now. We have between 25 and 30 million here in the United States at a cost of almost $600 billion to treat these people. Wow. So, but you know, the human side of this is what we're really trying to prevent. The social sadness that to see a father or a grandfather on dialysis or blind at the end life point. We can make a difference. We can stop this. There's no reason through caring, engagement, love, and fellowship. That's the equation we use at the hospital. And
there's things you can do right now. And one of the big things folks can do tonight is get educated. You have questions. You want to know why things with diabetes happen. You get those answers tonight.
Absolutely. And even if you have no questions, it's a fellowship where other people will, and you can learn. And as I said, all the details of what doctors that would be there are going to be on Greenwood Leflore Hospital's Facebook. Just look that up. You will see, and I look forward to seeing you there tonight, and somebody else that you may know may come tonight too.
Yeah, absolutely. I'm really hoping to be there. I know it's going to be educational and a lot of fun too. All happens tonight at 6 o'clock at Greenwood Leflore Hospital. If you have the chance, you definitely want to be there. It'll definitely be a learning thing. Thank you, Dr. Assini, for putting this on and for being here this morning.
And next week we're making something special for Thanksgiving.
And next week it's Thanksgiving. We got Dr. Assini in the kitchen, so I can't wait for that one. Well, stay with us. We have more coming up after the break.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.